Thank you, Chairman. I want to start by praising Chair Kathy Rogers, who was, of course, the first woman to chair the Energy and Commerce Committee in its more than 200-year history. Kathy, I've really enjoyed working with you over the years, but especially the last 3 years as you served both as ranking member and as now as the chair. I think you've made a lot of progress in this committee's effort to accomplish things, including this year, the bipartisan legislation to lower healthcare costs and increase transparency in hospital pricings. And, you know, you're leaving. I still don't want you to leave, but I always say that, and then nobody listens to me. But, you know, it's going to be a big loss for Congress and this committee. But I don't want to dwell on it too much because we still have the rest of the year and we can still accomplish a lot. So, exactly. So I'm going to leave it at that for today and talk about our work today, which is to consider 18 bipartisan bills to reauthorize or create several important public health programs. This subcommittee will hear from a diverse panel of expert witnesses representing families affected by mental health, trauma, and discrimination. And I'm pleased that we'll be discussing H.R. 6829, the Cardiomyopathy Health Education Awareness Research and Training in Schools Act, or the HEARTS Act, which I introduced in December. The HEARTS Act will save lives by increasing awareness of cardiomyopathy and helping prepare schools to deal with cardiac emergencies when they occur. When I announced the introduction of this bill, I was joined by members of 2 New Jersey families that each tragically lost a young son to this condition during high school sporting events. The legislation directs the Secretary of Health and Human Services to develop guidelines on the placement of automated external defibrillators, or AEDs, in schools, and to provide resources to help schools create and implement a cardiac emergency response plan. And the use of AEDs during a cardiac emergency increases the chance of survival from 5% to over 50%, which could save up to 40,000 lives each year. Aside from the HEARTS Act, there are many bills before us today that reauthorize important public health initiatives. I'll start with the need to reauthorize several autism spectrum disorder programs, as autism is one of the fastest growing developmental disorders, affecting 1 in 36 children in our nation. Today, we'll hear the impact of 3 important bills to extend funding for family-led organizations to help children with special health care needs. The bills reauthorize crucial research, training, and monitoring for autism research until 2029, and reauthorize respite care provided to children and adults with special needs. Another challenge before us is helping Americans with Alzheimer's disease. We know an estimated 6.7 million Americans over the age of 65 are living with Alzheimer's dementia, and it's the 5th leading cause of death for people 65 and older. We'll discuss 3 bills that will support continued coordination of federal planning to promote healthy aging, healthy aging and bolster the National Alzheimer's Project and support early detection, diagnosis, and dementia caregiving. We're also discussing legislation that will provide support to our nation's healthcare providers who have experienced unprecedented levels of stress and burnout that was only exacerbated by the COVID-19 pandemic. Today, we'll hear directly from a family who has turned tragedy into life-saving relief for our healthcare professionals by creating a program to implement evidence-based strategies to reduce and prevent suicide, burnout, and substance use disorders among those who are on the front lines of patient care. And we'll also examine bills to reauthorize grant funding for improving emergency medical services in rural areas, supporting our poison control grant program, and providing states with access to services and support for people with traumatic brain injuries. And we'll discuss bipartisan bills to support a broad variety of public health initiatives focused on stillbirth, Down syndrome, and cancer screenings for women. So there's a lot going on today, all very positive, and I look forward to hearing from our witnesses about the impact these programs have on the American people and our overall public health infrastructure. So with that, Mr. Chairman, I yield back the balance of my time.